Managing obesity in older adults is a delicate but deeply rewarding process, one that calls for a thoughtful, individualized approach. Unlike younger populations, where aggressive calorie restriction or high-intensity exercise might be options, older adults often face a combination of slower metabolism, muscle loss, limited mobility, chronic disease, and emotional challenges that make conventional weight loss strategies not only ineffective, but potentially harmful. The goal in this age group is not rapid fat loss or ideal body mass index, but rather preservation of strength, independence, metabolic health, and overall quality of life. Done well, targeted interventions can not only reduce health risks but also restore energy, mobility, and joy to daily living. Physical activity is one of the safest and most effective starting points, but it must be approached with care. Many older adults live with arthritis, balance problems, or cardiovascular limitations that make vigorous activity unsafe. Yet, inactivity only accelerates decline. Gentle, low-impact movements such as walking, tai chi, water aerobics, or chair-based resistance exercises can significantly improve mobility, joint function, and mood. Strength training is especially important because it helps prevent further muscle loss, known as sarcopenia, which is a major contributor to frailty and reduced metabolic rate. Even modest gains in muscle mass can improve blood sugar regulation, reduce inflammation, and ease the physical burden of obesity on joints and the heart. Importantly, physical activity also fosters a sense of agency and emotional well-being, reducing isolation and depression. Nutrition interventions must strike a careful balance between reducing energy intake and maintaining nutritional adequacy. Older adults need fewer calories, but more protein, vitamins, and minerals per unit of food. Diets should emphasize nutrient-dense options, leafy greens, colorful vegetables, berries, legumes, whole grains, nuts, seeds, and lean proteins like fish, poultry, tofu, and eggs. Protein intake should be prioritized at every meal to support muscle maintenance, ideally reaching at least 1.0 to 1.2 grams of protein per kilogram of body weight per day. At the same time, processed foods high in sugar, sodium, and unhealthy fats should be minimized, not just to control weight, but to lower inflammation, protect cardiovascular health, and support cognition. One of the most powerful tools in dietary planning for older adults is the concept of volume eating, choosing foods that are high in fiber and water but low in calories, like soups, stews, steamed vegetables, and salads. These foods help control appetite without sacrificing satisfaction. Small, frequent meals may be better tolerated than large ones, especially for individuals with digestive issues or reduced appetite. Supplements may be necessary if dietary limitations prevent adequate intake of nutrients such as vitamin D, B12, magnesium, or calcium. Equally essential is the psychosocial dimension of obesity treatment. Many older adults face emotional eating, loneliness, or grief-related weight gain that cannot be solved with food plans alone. Support groups, counseling, or social programs can provide the connection and purpose that underpins sustainable behavior change. Family involvement can be a major asset. When caregivers understand the importance of portion control, healthy cooking, and shared activity, outcomes improve. At the same time, it's important to respect the autonomy of older adults, many of whom may resist dietary changes if they feel patronized or pressured. Interventions work best when they are collaborative, respectful, and focused on function rather than appearance. Medical oversight is critical throughout this process. Many older adults take medications that affect weight, appetite, or energy levels, such as corticosteroids, antidepressants, or diabetes drugs. A thorough medication review by a geriatrician or pharmacist may uncover opportunities to adjust treatment plans and reduce side effects. In some cases, medical nutrition therapy or supervised weight loss programs tailored to seniors may be appropriate. However, bariatric surgery and weight loss drugs, while sometimes used, require careful risk-benefit analysis in older populations and should not be first-line solutions unless other options have failed and comorbidities are severe. Importantly, expectations around weight loss in this population should be realistic. A reduction of even 5 to 10% of body weight can yield significant improvements in blood pressure, blood sugar, joint pain, and overall vitality. For some older adults, maintaining current weight while improving diet and activity may be a more appropriate goal, especially if they are already frail or under stress. The focus should remain on improving energy, reducing medication dependence, enhancing sleep, and increasing day-to-day enjoyment of life. Ultimately, obesity in older adults is not an unsolvable problem. With thoughtful, gentle interventions that combine physical movement, nutrient-dense meals, emotional support, and medical guidance, it is possible to reverse some of the damage caused by excess weight and chronic inflammation. More importantly, such approaches offer a path not just to better health, but to a more vibrant and autonomous life. Rather than approaching weight loss as a burden or punishment, interventions for older adults should feel like an act of care, a way to help them remain active participants in their own lives for as long as possible.